If you are over 60, some vitamins on your shelf right now could be slowly destroying your brain, heart, and nerves, and no one is telling you. That is right. While the vitamin industry promises health and vitality, 4 common vitamins could be putting you at serious risk. But here's the good news. There are also 4 life-saving vitamins that could dramatically improve your memory, balance, and muscle strength. One dangerous vitamin is hiding in most multivitamins and has been linked to permanent nerve damage. Meanwhile, one essential vitamin could be the key to protecting your brain function. I am Dr. Ethan Carter, and in my 15 years of practice, I have seen too many patients suffer because they did not know which vitamins help and which ones harm. Stay with me, because what you learned today could add years to your life. Before we begin, I would appreciate it if you like this video. If you have not subscribed yet, I recommend you subscribe and turn on the bell so you do not miss any videos. If you like this video, please comment number 1. Now, let us get started. The vitamin industry is worth over $40 billion globally. Companies flood the market with products promising to help seniors stay healthy. But here is what they don't tell you. After age 60, your body changes dramatically. Your metabolism slows down, your kidneys process nutrients differently, and your ability to absorb certain vitamins decreases while your sensitivity to others increases. What worked for you at 40 might be dangerous at 65. Some vitamins can build up in your system over time, creating problems that don't show up until years later. Many people over 60 are taking vitamins they think are helping them, but these same vitamins are quietly contributing to nerve damage, heart problems, and cognitive decline. Today, we're going to separate the helpful from the harmful. Dangerous vitamin number 4, high-dose vitamin E. Vitamin E has been marketed as the ultimate anti-aging vitamin for decades. High-dose vitamin E supplements promise to protect your heart and prevent wrinkles. The reality is far more concerning for people over 60. Large-scale studies, including research published in the Mayo Clinic Proceedings, found that taking more than 400 international units of vitamin E daily actually increases your risk of death from all causes. This is a significant rise in mortality rates. Vitamin E is fat-soluble, which means your body stores it in fatty tissues. After age 60, your body becomes less efficient at processing excess fat-soluble vitamins. This means vitamin E builds up over time, reaching potentially toxic levels.
High-dose vitamin E interferes with your blood clotting. If you are taking blood-thinning medications, like warfarin or aspirin, this combination can be deadly. The vitamin amplifies these medications, increasing your risk of dangerous bleeding. Margaret, a 67-year-old patient, came to me complaining of unusual bruising and fatigue. She was taking 800 IU of vitamin E daily. After stopping the supplement and switching to natural food sources, her symptoms resolved within weeks. The safe daily intake is just 15 milligrams, which equals about 22 IU. You can get this from almonds, sunflower seeds, spinach, and olive oil. Dangerous vitamin number 3, retinol form vitamin A. Vitamin A is essential for vision and immune function, but the synthetic retinol form found in most supplements can become toxic quickly, especially as you age. Unlike beta-carotene, which your body converts to vitamin A as needed, synthetic retinol goes directly into your system whether you need it or not. After age 60, your liver becomes less efficient at processing vitamin A safely. Excess retinol causes liver damage and interferes with bone metabolism, increasing your risk of fractures. Research published in the New England Journal of Medicine found that people with high vitamin A intake had significantly weaker bones and more fractures, particularly dangerous hip fractures. The problem is that retinol hides in many products. Fortified cereals, energy bars, and multivitamins contain significant amounts of synthetic vitamin A. If you are eating fortified foods and taking a multivitamin, you could easily be getting 5 to 10 times the safe amount. Instead of synthetic retinol, focus on beta-carotene from natural sources, like carrots, sweet potatoes, spinach, and cantaloupe. Your body will convert exactly as much as it needs, and any excess gets safely eliminated. Dangerous vitamin number 2, vitamin B6 over 100 milligrams. Vitamin B6 is crucial for nerve function and mood regulation. At normal doses, it is safe and beneficial, but many supplements contain dangerously high amounts, and the consequences are irreversible. The recommended daily amount of B6 for people over 60 is just 1.5 to 1.7 milligrams. Yet many supplements contain 50, 100, or even 200 milligrams per dose. Excess B6 causes peripheral neuropathy, which means permanent nerve damage. The symptoms start subtly. You might notice tingling in your hands or feet, burning sensations, or numbness in your fingertips. But if you are taking high-dose B6, the vitamin itself could be destroying your nerves.
This nerve damage is often irreversible. Once B6 destroys the protective coating around your nerves, the damage is permanent. You could be left with chronic pain, loss of balance, and difficulty using your hands. I treated Linda, a 69-year-old woman who developed severe numbness in her hands and feet. She had been taking a B-complex supplement containing 100 milligrams of B6 daily for 2 years. By the time she came to see me, the nerve damage was so severe that she could barely feel her fingers. Natural food sources like chickpeas, salmon, potatoes, and bananas provide B6 safely. If you need a supplement, look for one containing no more than 10 milligrams of B6. Dangerous vitamin number 1, iron, if not deficient. Iron takes the top spot as the most dangerous vitamin for people over 60 who are not deficient. While iron is essential for carrying oxygen, excess iron becomes a silent destroyer of your organs. Unlike most nutrients, your body has no efficient way to eliminate excess iron. Once iron enters your system, it stays there, accumulating in your liver, heart, and brain. After age 60, this buildup accelerates. Excess iron creates oxidative stress, which is like internal rusting of your organs. This damage contributes to heart disease, stroke, diabetes, and certain cancers. Research published in the American Heart Association journals found that people with high iron levels had significantly more heart attacks and strokes. James, a 74-year-old patient, had been taking iron supplements for years, assuming he needed them for energy. His blood tests showed iron levels nearly twice the normal range. After stopping the supplements, his energy actually improved. Unless blood tests confirm that you are iron deficient, avoid iron supplements completely after age 60. Most people get adequate iron from leafy greens, beans, and lean meats. If you take a multivitamin, choose one that is iron-free. Life-saving vitamin number 4, vitamin K2, MK7 form. Vitamin K2 is the most underrated vitamin for people over 60, yet it could prevent heart disease and osteoporosis simultaneously. Unlike vitamin K1, which helps blood clotting, vitamin K2 has a different vital job. Vitamin K2 acts like a traffic director for calcium in your body. It guides calcium into your bones where you need it and keeps it out of your arteries where it causes problems. Without adequate K2, calcium supplements can actually increase your risk of heart disease.
Research published in the European Heart Journal followed over 16,000 women for 8 years and found that those with the highest K2 intake had significantly less arterial calcification and lower rates of heart disease. The MK7 form stays active in your body for several days. Mary, a 68-year-old patient, had been taking calcium supplements for years but continued to lose bone density. After adding MK7 form vitamin K2, her next bone density scan showed improvement for the first time in years. Look for MK7 form vitamin K2, typically dosed at 100 to 200 micrograms daily. It works best combined with vitamin D3 and magnesium. Take K2 with a fat-containing meal for better absorption. Life-saving vitamin number 3, vitamin D3. Vitamin D3 is one of the most important vitamins for healthy aging. After age 60, your skin becomes less efficient at producing vitamin D from sunlight, and your kidneys become less effective at converting it to the active form. Vitamin D3 plays crucial roles in muscle strength, balance, immune function, and mood regulation. Low vitamin D levels are associated with increased falls, fractures, infections, depression, and cognitive decline. Research published in the Journal of the American Medical Association found that people over 60 with higher vitamin D levels had significantly better muscle strength and balance, reducing their risk of dangerous falls. Frank, a 72-year-old patient, complained of muscle weakness and frequent colds. His vitamin D blood level was severely deficient at 12 Ng per ml. After 3 months of vitamin D3 supplementation at 2000 IU daily, his muscle strength improved noticeably and he stopped getting sick so often. Most people over 60 need between 1000 and 4000 IU of vitamin D3 daily based on blood testing. Take vitamin D3 with healthy fats like olive oil or nuts to improve absorption. Life-saving vitamin number 2, magnesium glycinate. Magnesium is involved in over 300 biochemical reactions in your body, yet up to 60% of people over 60 do not get enough. This deficiency contributes to muscle cramps, poor sleep, irregular heartbeat, and high blood pressure. The glycinate form is particularly valuable for older adults because it is highly absorbable and gentle on the digestive system. Other forms can cause stomach upset, but glycinate is well tolerated. Magnesium supports your cardiovascular system by helping blood vessels relax and maintaining normal heart rhythm. It also plays a crucial role in bone health and acts as a natural relaxant for better sleep.
Dorothy, a 65-year-old patient, suffered from severe leg cramps that woke her up nightly. After starting magnesium glycinate supplements, her cramps virtually disappeared within 2 weeks, and her sleep quality improved dramatically. I recommend 300 to 400 milligrams of magnesium glycinate daily, preferably taken in the evening because it promotes relaxation and better sleep. Life-saving vitamin number 1, Methylcobalamin, B12 active form. Vitamin B12 takes the top spot because deficiency is extremely common after age 60, and the consequences can be devastating. B12 is essential for nerve function, brain health, and red blood cell production. Without adequate B12, you can develop irreversible nerve damage and cognitive decline. B12 absorption decreases dramatically as you age. Your stomach produces less acid, which is needed to separate B12 from food proteins. Many people over 60 also take acid-reducing medications that further impair B12 absorption. The early symptoms are often mistaken for normal aging. Fatigue, memory problems, balance issues, and mood changes can all be signs of B12 deficiency, but they develop so gradually that they are easy to overlook. Methylcobalamin is the active form of B12 that your body can use immediately. Sublingual tablets that dissolve under your tongue are particularly effective because they bypass the digestive system entirely. Eleanor, a 78-year-old patient, came to me concerned about increasing forgetfulness. Her family was worried about dementia, but blood tests revealed severe B12 deficiency. After 3 months of methylcobalamin supplementation, her memory improved significantly, and her energy returned to normal levels.
Most people over 60 benefit from 500 to 1,000 micrograms of methylcobalamin daily, taken sublingually for best absorption. Let me summarize the key points that could transform your health after 60. Avoid these 4 dangerous vitamins: high-dose vitamin E over 400 IU, retinol form vitamin A, vitamin B6 over 10 milligrams, and iron unless you are deficient. Focus on these 4 life-saving vitamins: vitamin K2 in MK7 form, vitamin D3 based on blood testing, magnesium glycinate for better sleep and heart health, and methylcobalamin B12 in sublingual form.
Check your supplement labels tonight. Schedule blood tests to check your vitamin D, B12, and iron levels. These simple tests will guide your supplementation strategy. What surprised you most in today's video? Was it learning about the dangers of high-dose vitamin E, or discovering the importance of the MK7 form of vitamin K2? Drop a comment below and let me know which vitamin you are going to change first. If this video helped you understand vitamins better, please give it a thumbs up and share it with friends or family members who might benefit. Subscribe to Better Elder and hit the notification bell so you do not miss future videos about staying healthy as you age. Thank you for taking charge of your health.